Good morning, good afternoon, and welcome everyone to today's webinar. This is a two-part webinar. The theme, Chaplaincy, Naming the Heart and Soul of Our Profession. Part 1, Chaplaincy, Professionalism, and Labyrinthic Purposiveness. I'm Andrew Andresco, Project Coordinator for Transforming Chaplaincy, and we are all delighted you could join us. Some housekeeping instructions off the top. You are listening in using your computer speaker system by default and are muted. This webinar is being recorded. Should you have any technical questions regarding your audio or visual, please put those into the chat box located in the platform's dashboard. You will have the opportunity to submit text questions for our presenter by typing your questions into the questions pane of that same control panel. You may send in your questions at any time during the presentation. We will collect these and hope to include them during a Q&A session at the end of today's presentation. With that, I'd like to introduce Transforming Chaplaincy former director and current senior advisor, Dr. George Fichette.
Andy, thanks so much for getting us started and for your good work with the webinar. As we get ready to kind of move into the presentation, I just want to do a little bit of promotion here. Those of you who are familiar with Transforming Chaplaincy know that research literacy education is one of our important missions, and one of the ways we advance research literacy education for spiritual care providers is we have a week-long Chaplaincy Research Summer Institute, which we like to call the Summer Camp. And that Summer Institute will be in about 5 weeks. We'll be holding it this year in Los Angeles. We're hosted by Cedars-Sinai Medical Center, and we're really grateful for their hosting this for us. July 17th to 21st, you see the QR code if you'd like more information. We have a few seats left, and we'd very much welcome you joining us for the Research Summer Camp. So give that a thought if you can. We'd love to see you, and we do have colleagues who come from around the world. So those of you who are listening today who might not be on the west coast of the US, we'd love to have you if it's possible for you to join us. Andy, let's go back to the presentation slide. Friends, as Andy said, we're going to do a two-part webinar series today, and then we're going to come back again on July 12th, same time. And the series is designed to kind of help us think about changes that are happening in our profession. And as we say in the title here, what is the heart and soul of who we are and what we do? Changes happening all around us. There are changes in our cultures, such as secularization. There's certainly changes in our healthcare system. And there are changes in the work that chaplains do. For example, the growth of importance of an outcome-oriented perspective on spiritual care. And we want to kind of take a minute in these two webinars to step back a second and kind of think about what do these changes mean for chaplains, for the heart and soul of the profession. And so that's what we'll be talking about in the webinars. Today, the focus will be chaplaincy, professionalism, and labyrinthic purposiveness. We love the title, and our presenter will tell you more about that. Part of what Niels and Anne are going to talk about today is whether or not being professional, professionalization, is that a good thing for chaplains? Not all chaplains think so. Some have argued that professionalization compromises the essential spiritual nature of our profession. So in today's webinar, Niels is going to propose a new model for professionalism in chaplaincy, which he's going to argue does not compromise the spiritual nature of our profession, but rather, among other things, the perspective of professionalism will help us understand the changes that are taking place in chaplaincy, such as the role of research. And further, based on Niels's research with the chaplains who participated in the very, very important Dutch case study project, he will argue that to develop the profession, it is important to identify our values and our goals. And he's going to suggest this wonderful phrase, labyrinthic purposiveness, as a fruitful approach to developing chaplaincy goals. So let me introduce to you Niels den Toom. Dr. den Toom is an assistant professor at Tilburg University in the Netherlands. He also works as a chaplain in a nursing facility, and his doctoral research examined professionalism and professional identity in the chaplains who participated in the Dutch case study project. We can provide the link for those of you who want to read Niels' dissertation and other publications about his dissertation and the work with research about the chaplains in the case study project have been published and will be published. I had a chance to read his dissertation, and I just thought it was really fascinating and informative, and part of why I said, Niels, we have to have you come and tell our colleagues about some of your important work. Joining Niels in conversation about the heart and soul of our profession is Anne Vandenhoeck. Dr. Vandenhoeck is a professor on the Faculty of Theology and Religious Studies at KU Leuven University in Belgium. Anne is the chair of the Academic Center for Practical Theology at KU Leuven. And as many of you know, she's the director of the European Research Institute for Healthcare Chaplaincy. And Anne is also a member of the ISPEC faculty, along with Christina Pahalski and Betty Farrell, and comes over to the US periodically to help teach in that. And we're very grateful to both Niels and Anne for today's webinar. So Niels, I'm going to turn it over to you.
Thank you, George, for this introduction, also the introduction of my research and what I'm talking about today. Let me see. In order that you see both my presentation and myself, and I think you see both right now. And can you not, if that's the case? And can you not, if you see both my presentation? And okay, thank you. Then I'll start. Thank you for having me here. I'm honored to be here today to share some of my thoughts from my PhD study. As George said, I've been working as a chaplain several years, also working now currently as an assistant professor at Tilburg University. And today I would like to share some thoughts about chaplaincy and professionalism, which are based on my PhD study and on my experience as a chaplain. Say something about my PhD study will be very brief. I studied the chaplain researchers that participated in the Dutch case studies project, which were over 50 chaplains, and they participated as co-researchers for more than 4 years. And I focused on how does participation in a research project, being both a chaplain and researcher, affect their thoughts about practice, but also their behavior. And I used the angle of professionalism to understand what is happening in the change. And I conducted a mixed methods empirical study and reflected on the findings. And what I share today are mostly reflections on the findings. So not so much the empirical findings themselves. You will find them in the PhD dissertation if you want to read it, but some thoughts about how the profession is changing and how to think about it in a way that might benefit the profession. So talking about chaplaincy and professionalism, chaplaincy is of course a very old practice, coming from care, from religious and worldview communities. But as a separate profession, it's rather young. It emerged, well, let's say, in the second half of the 20th century in most contexts. And saying that chaplaincy is a profession will meet with much approval, but saying that you should pursue professionalism or even professionalization can meet with resistance. And what I will do today is argue that it's relevant to regard chaplaincy as a profession, and also I'll propose a way to do it in a way that is appropriate to the heart and soul of the profession. And it will be in 2 parts. So today I will primarily talk about the goal orientation of chaplains, but in July 12th, I will also talk about what kind of knowledge and expertise do chaplains have, and also how are they religious or worldview professionals in a post-secular context. In Netherlands, where I come from, the notion of professionalism has been contested. It is often opposed to ministry or opposed to spirituality, and discussions on the concept have been going on for several years. And I think one of the reasons is that professionalism is kind of an umbrella term which is often not very well defined and which covers a plethora of underlying assumptions. For example, if we use the notion of professionalism in daily language, it's mostly refers to things like quality of work or work that's not voluntary but paid for, or some form of being detached. For example, if there's a nurse on the ward who gets emotional because of the situation of a patient, sometimes they say, well, I won't cry because that's not professional. And then professional stands for kind of emotional or spiritual neutrality. Others say, well, when you are really a professional within a professional organization, this also means that you kind of lose your critical independence from the organization, and you cannot be critical anymore on what's going on, and you will lose also your prophetic function, for example. And other arguments that are used is that if you go along with the paradigm of professionalism, that you will more or less reduce clients to their problems. And the idea is that many professions have a kind of model like you have a diagnosis, there's a sort of problem, then intervention, and then an outcome. It's of course a bit simplified. We see that because the terminology of diagnostics or assessment and interventions and outcomes are now also present in chaplaincy. But the idea is that they see other professionals mainly focusing on people's problems, and they say, well, we don't want to be like that. We want to discuss emotional and spiritual issues. We don't want to be detached. We don't want to reduce people to their problems. And we do want to have critical thoughts about what's happening in the organizations. So that's why some people say professionalism is not the right notion. My response would be, I understand, but that's not what professionalism is about. So let me give another perspective on professionalism. And I'm inspired by the work of the sociologist Elliot Friedson and his approach to professionalism. And it's interesting, in his early career, he was very critical about professionalism. So he studied it from the so-called power approach. He noticed that many professions had too much power over the client or patient, and they did not really have a voice. And that professionalism kind of was focused on themselves and the status they had, the monopoly they have, and it was mainly about power. So it was a critical approach. And then through time, he kind of changed his mind and came to a new view on professionalism. And he said, well, it might be the case that some, or perhaps many professions are focused on themselves, but in the essence, professionalism is about the values they pursue and want to safeguard for society. And he developed a kind of ideal typical model. It's a rather simple model, and it consists of 3 dimensions. It first has as the value orientation, which is central in its view. Then there's the expertise and the positioning. I'll tell you something about these 3 dimensions. I adapted them slightly from his model. He sees the values of a profession as the heart and soul of the profession. That's their mission. That's what they are for. That's why they do what they do. And he takes some examples from the classic professions, like, for example, the medical profession, which pursues, for example, the value of health in society, or the legal profession, which ideally focuses on justice in society. And so he came to an analysis of professionalism.
Niels,
from the
let me interrupt a little bit and ask you to kind of stay as close to the microphone as you can, because it breaks up a little bit.
Okay, yeah, thank you. I'll try. And let me know if it's necessary to come even closer. Yeah.
Thanks.
Values are important, he said, and that's ideal, typically what a profession pursues and what's driving them. And professionals pursue these values by exerting their expertise, for which they mostly have learned for quite a long time. And chaplains, for instance, use their knowledge on religion, on meaning, on ethics, on spirituality and existential questions. And they do this to pursue a greater good for their clients. Next to the expertise, there's also the profession needs to be organized and embedded in such a way that one is able to exert the profession. So if you're not embedded in the organization, you won't be able to exert your expertise, and as a consequence, you won't be able to pursue the values for which you are within the context you work in. So every profession has its expertise and needs to be embedded and integrated, but not for the sake of the profession itself or for your own job, but to pursue the values you're oriented at. And ideally, this is kind of an upward spiral because the values are never fully attained. And this leads to kind of continuous improvement of expertise, the continuous improvement of the positioning in order to pursue those values. So this is the model, the triangle professionalism, which is actually kind of circular model. However, the model helps to understand what's going on in chaplaincy. And one of the things I noticed and reflected upon was that it's actually not very clear what the central values of chaplaincy are. And it's also underlined by Hanzo and colleagues. They argue that there's little consensus on relevant outcomes and values that undergird them. And that there's increasing plurality among chaplains regarding worldviews complicates the effort to find a central value. Perhaps there should be made a distinction between some core values, which are shared by the majority of chaplains, and some, for example, additional values that are specific for your own worldview or the way you are trained as a chaplain, that are not shared by all. Well, I'll return to the issue of values and goals later, but for now I would like to stress the heuristic value of this threefold model of professionalism. For instance, it helps to understand the current changes in the professional field. In the past, I would say chaplaincy was primarily focused on the value level. Many chaplaincy theories emphasize that part, like we are about being there for people. We have an holistic view, or we are about acknowledging people. And those are not so much precise descriptions of what chaplains do or their expertise, but indicate the values they hope to realize in their practices. They hope that they acknowledge people or that people feel acknowledged. And they hope that they can be there for other people, but how they do it and based on what expertise is not very clear. So only emphasizing the values makes one wonder what the exact expertise of chaplaincy is. And let me give a short example of what happened in the Netherlands. There's, for example, what we have is the so-called presence approach. It's developed by a Dutch sociologist and theologian, Andries Baert, based on a study among chaplains in urban areas. And this model has become such a success that it's also adopted by many social workers and all kinds of professions in the social domain. And they all work according to the presence approach right now. So if you ask a chaplain, what do you do? And they say, well, I work according to the present approach. The social worker would also say, well, I do as well. And it would not be clear what the exact approach or expertise or perspective of chaplains are. And I would say the expertise of chaplain has to do with the domain of worldview and meaning. And this also has to be integrated in the profession. The emergence of research in the last decades have put much more emphasis on the expertise of chaplains. Think about case studies or the Dutch case studies project. We'll also think about prompts, which is more about outcomes, but also about what chaplains did to attain those outcomes. Think about intervention studies. And all these studies on the expertise of chaplains might strengthen the case for chaplaincy in their legitimation, so that other people can acknowledge the value of chaplaincy. That's the part of the positioning of chaplaincy. But it can also help to improve chaplaincy. A prompt, for example, might reflect us, are the things that we do as chaplains, do they really contribute to what our clients need? So then it would be on the expertise side in relation to the values. So do you really attain the values you think or you hope you realize? Professionalization is not something only about the positioning, about legitimation, but also about the improvement of practice in the profession. So I think the turn to expertise in the decades behind us and in the research paradigm of research informed chaplaincy, which is all about expertise, is very important. Yet, in order to also professionalize, it's important in the fruitful model to keep an eye on the values. So to align research with the values of the profession. And I think there's some daylight between the value orientation and the expertise so far. So we need to take a look at that. Ideally, the research on chaplaincy is aligned with its value orientation, but this is not necessarily its practice. And I think the values of a profession are prior to research, so they cannot really be derived from research as such, but need to be defined by the profession itself before conducting research. And nevertheless, like I said, research like the prompts may help us to correct our presuppositions about the client and to also our presuppositions about our values. Let me take an example from Professor Vandenhoeck, who is present here today, to see how there's some daylight between the values and the expertise of chaplains. He writes, raising the profile of chaplaincy in the context of professionalism in healthcare ties chaplaincy to research. My students know I'm slightly allergic to chaplains' reaction when asked by other professionals or by patients what they are doing, and their sole answer is, I am here to listen. Yes, of course, chaplains are there to listen. Yes, active listening for a few hours a day is hard work. And yes, listening to patient stories is fundamental and makes them feel accepted. And one needs training for listening. But why would the chief executive and her board attribute money out of a tight budget to a chaplain who's there to listen? And I think this quote is not only about can you formulate what you do more than listening, but it's also about are you formulating what you are doing? So it's what I see is that chaplains do not only say they listen, they want to express their complete availability to a client, with their intention to be there for the client. But their expertise, in fact, if you would study that, like we did in the case studies project, well, it appears to be much and much richer than just listening. But it might be the case that these things do not fit in the ideological scheme of the chaplain. For instance, chaplains might be more directive than they think they are. They say, well, I'm not non-directive, I just follow the client. But if you really look at their cases and their accompaniment process, most of the time they are quite directive in some parts of the conversation. Or it appears that they have some sort of own agenda. For example, when they want to guide the client away from what they consider unhealthy beliefs, whatever that may be, of course. But most of the time there are some normative dimensions, and chaplains do have an expertise, and they do guide and steer their clients. And all this is about the goal orientation of chaplaincy, on which I will focus now. So I'll focus mainly on the value orientation, which is connected to a more pragmatic side of goal orientation. And this is an important aspect of professionalism. And The reflection I offer now is based on one of the important findings of my PhD study. Like I said, I've studied how participation as a chaplain researcher in the case studies project has affected chaplains' professionalism. And it appeared that chaplains who had participated in the case studies project, describing and analyzing their own practices, became more aware of their implicit goals. I found the chaplains became more aware of their goals, but also for about half of the chaplains, but also that a considerable group of chaplains set objectives more often. So they not only value it increasingly important, but also they set objectives more often. And my colleague Anja Visser has talked in a webinar like this before on the goals of chaplaincy. And chaplains are getting more and more accustomed to thinking about goals in chaplaincy. But still, also in the field, and when I speak to colleagues, there's quite some hesitation towards thinking about goals in chaplaincy. And initially, also the chaplains in the case studies project were hesitant, and there might be several explanations for that. First, chaplains often stress that they are kind of interest-free, that they do not have an own agenda. And saying that you have a goal feels like you have a different agenda. Second, as several studies argue, chaplains often focus more on the relationship and the process of chaplaincy care than on the goals and the outcomes. This is partly because they assert that meaning and spirituality cannot be pursued and approached and reached directly. Further conviction that religion and meaning should not be instrumentalized for something else, but have an intrinsic value. For example, one does not pray primarily for someone to feel better, but first of all, to express their gratitude or their sorrows to God. Fourth, there are fundamental and critical issues of power and equality in using goals in chaplains. And the most often question is then, whose goals are exactly pursued? Are it your goals as a chaplain or the goals of the client? Which might be a false opposition, but the question is important. And the final issue that dissuades chaplains from speaking of their goals is that goal orientation is easily confused with solution orientation. Like if you have a goal and all the sorrows and existential questions of our patients will be gone after one or two conversations. So that's more like a solution oriented. And in this section, I argue that chaplains' purposiveness does not necessarily pertain to problems or that they have to be solved. But having said this, one could still wonder, okay, perhaps no goals, but why then do chaplains do what they do? They do have a reason for what they do, don't they? If they respond to one part of the conversation, one part of the life story of the client, why do they respond to exactly that part of the story, and why in the way they respond? Well, traditionally, chaplains have not been accustomed to accounting for their goals. Coming from religious or worldview communities, they justified their presence primarily in relation to those communities. And the rationality of chaplaincy can be characterized as primarily value-oriented in a Weberian way, like Max Weber has typified it. Weber distinguished between two sorts of rationality that guide actions. First, there's the instrumental rationality and a value rationality. And the instrumental rationality focuses on outcomes that determines one's actions, while a value orientation seeks to undertake certain actions for their own sake, so not in order to do something else. And in the past, this value-oriented rationality predominated in chaplaincy. So I am here because I'm here for example, marginalized people, and that's a value in itself, no matter what the outcomes of my encounter will be. Which is also primarily on the value level rather than on the level of the methods or the goals. And I think this distinction between a value orientation and the value originality and instrumental originality is important, but it's not really absolute. As a chaplain, one also uses various forms of instrumental originality and a more pragmatic approach. In a ritual, for example, chaplains hope that clients find comfort or experience love or see that the story of the client is acknowledged. And they want to contribute to the clarification for the client. That the client is able to make, for example, a moral decision. That's not only a value, that's also a kind of instrumental rationality. But apparently the notion of goals might sound too directly and too active for chaplains. And it might therefore be better to talk about the purpose and the purposes of chaplaincy, or its purposiveness. Talking about the purpose of chaplaincy has several advantages. It connects concrete goals in chaplaincy to finding purpose, which is a general expression in chaplaincy. So it's that goals might sounds kind of strange or alienate chaplains from their heart and soul of the profession, but purpose is closer to the language they use. It also refers to the larger narratives and traditions to evaluate specific goals. For example, a chaplain may ask in a care setting whether the use of a robot adds to the larger purpose of what care is about. So it's a kind of larger story, larger narrative, the purpose of care to which chaplain can relate. So it's not only their specific goals like an instrumental rationality, but also to the larger narratives. But also worldview traditions have certain goals and values, which help to critically assess what good care is about. If you talk, for example, about the Christian tradition, there are also all kinds of goals like imitatio Christi or the kingdom of God, and there are all kinds of goals also within religion itself. So talking about goals is not alien to religions, I would say, also not alien to worldviews. And from a worldview perspective, one could, for instance, consider that a visit to a client has a purpose in itself, demonstrating concern for the vulnerable. An encounter with the client may be successful not only if certain goals of transformation are achieved, but can also be meaningful in itself. For example, keeping vigil over a dying client in a nursing home cannot be expressed in terms of usefulness, like what was the use exactly, what was the outcome. Perhaps there was no outcome, but still not letting someone die in loneliness is something that can be a goal or a value of chaplain, which they strive for. And it may be expression of chaplains' professionalism. In other words, the focus of chaplains on purposiveness is primarily one of meaning and values, and secondarily one of usefulness in a more utilitarian sense, which of course also plays a role. So those are not absolute distinctions. And another advantage of thinking about purposiveness is that it has a language to talk about the goals of chaplains beyond a kind of problem orientation. So it's more about purpose than about a goal that has to be reached. To make this a bit more complex, because purposiveness is really a tongue breaker, right? But then I also added the adjective labyrinthic. But it might help us to think about how does this purposiveness or goal orientation of chaplain look like. And I have chosen the symbol of the labyrinth as a symbol for chaplain's purposiveness. In contrast to a maze, one cannot get lost in a labyrinth. So you might know labyrinths, which are pathways. This one is in the church, the Cathedral of Chartres, which is one of the most famous in the world. And the idea is that you walk kind of meditating these paths, and you enter in the center and try to come to the essence of what's important for you in a moment. But interestingly, it's not a linear, direct path. the path often diverges from the center. And that's kind of symbolic, I think, because meaning and spirituality can also often not be attained directly, but are often found more indirectly. In practice, there's often no linear path in the guidance of people regarding their worldview and meaning. The deep questions of life sometimes come to the fore only after several conversations in which the daily life has been shared. And in the focus group of my research, in my PhD study, some chaplains noted that their conversations often had different outcomes than they intended. It's also something interesting for chaplains. So the outcomes were very important, but different from them they intended in the initial referral. And as issues of worldview and meaning are fanned out over many areas of life, often kind of detour is taken to come to the destination. And chaplains who emphasize that they have no goals probably also want to express the importance of slowing down, of sojourning, or in other terms, to kind of search for depth in the conversation, which is kind of indirectly sometimes. So a conversation in chaplaincy is often not linear, but has many detours. And similar to the structure and intention of a labyrinth, chaplains are in contact with their clients for a reason. Perhaps they set a particular goal, be it implicit or not. And at the same time, chaplains allow themselves to be redirected by the client, to take a detour by reading a poem or viewing a painting, or lingering through the client's life story, knowing when silence is important and to be receptive. All those features are essential characteristic of chaplains' core orientation. And such sojourning could be regarded as drifting about or aimlessness, but can also be an effective way of approaching a complex issue from multiple perspectives, taking a different angle each time. As such, an indirective purposiveness requires both the stimuli of receptive sojourning and an active focus on the client's needs. So purpose does justice to the pragmatic side and also the expertise and sometimes even the technical side of chaplaincy, as well as to the spiritual process of a conversation. Well, draw to a conclusion now. So considering chaplaincy as a profession helps us to understand the developments in the profession. It also helps to assess the values within chaplaincy, and I think that's one of the conversations we should have right now in the profession. What are not only about the goals, but also the values behind the goals? Like what are we focused on, and how does this help us? And also, what kind of research do we then need to pursue those values? I think such a model of professionalism does not compromise the essential spiritual nature as long as the value orientation is leading. And speaking of purposes of chaplaincy, connects the expertise to the values of chaplaincy. It acknowledges both chaplains' goal orientation and their value orientation. It also helps to get focus in the care process. That's also what the chaplains in the case studies project experienced. Becoming aware of your implicit goals also provides you with the opportunity to focus more on those goals. And the notion of purposiveness might help prevent chaplaincy from being reduced to linear conceptions of spirituality and meaning. So this allows us for a wider perspective on purposiveness and the critical perspective of religions and worldviews. I'm convinced that thinking about the profession of chaplaincy in this way is not technical, but it can convince more technical-minded managers. It demarcates our professional domain, but not in a strict or linear way. In other words, thinking about the profession and its purpose in this way is a way of working at the heart and soul of the profession. So, thank you. I'm looking forward to respond.
Thank you, Niels. I just love the way in which you identify some important issues for the profession. and help us think about them in some new perspectives. But Anne, what do you think about all of this? What are your thoughts?
Well, I have many because I read some parts of the chapters that Niels has written in preparation for this webinar. But now that I hear him talk, they get a new meaning. And so I'm trying to grasp everything and try to be coherent, but I don't know if it will work. Anyways, the first thing that I wanted to say, Niels, it's very nice to use the image of the labyrinth. I think it's a process concept which fits very well with chaplaincy. And I have to say, the first time I walked a labyrinth was not in Chartres, which is very close to where I live, but in Grace Cathedral in San Francisco while doing CPE. So that's a nice thing that popped in my head. First, I want to congratulate you for this research because I think it really, as George said, it opens the concept of professionalism in relation to chaplaincy and makes us think with new input. And I think that's very necessary. And I want to congratulate you for the fact that you tried to do that without falling in the traps of polarization. Your whole research project is aimed at avoiding polarization and bridging polarization. And yet you don't stay away from mentioning the tensions that there are and naming them and reflecting on them. And as I was realizing that, I thought, well, maybe this is one characteristic of chaplaincy or one purpose of chaplaincy already. It is to transcend polarization and to keep things together instead of always choosing sides. And I think your research inspired that thought and is beautifully done in that way, that you are able also to keep spirituality and professionalism together is beautiful. And I applaud the fact that you devoted so much time to this topic. So thank you so much. That was what I wanted to give back to you from my enjoyment of reading your text and hearing you talk. The first feedback or remark that I wanted to make is you, of course, are talking from the context of the Dutch chaplaincy and the Dutch case study project and the Dutch context, which you don't hide and you talk about it freely. And this is not critique, but I want to, on an international level, draw the attention to the fact that, you know, if you talk from the point of view of the Netherlands, if you drive or you sail 300 kilometers to the west and you drive, 600 or 700 kilometers to the south and you drive 400 kilometers to the north, then there is not a distinction between religious or humanistic sources and the profession of chaplaincy. So this is something that we have to realize. There is, I think, a kind of cultural rootedness and a spiritual rootedness in chaplaincy that we cannot overlook. And that's not a critique, but it's something that we have to realize on an international level, because if we avoid talking about differences on a cultural and a spiritual level, we risk colonizing the audience with our own concepts and our own concepts of chaplaincy within our environment. So for myself, I had to, for example, divorce myself from the meaning that I give to values, because in my context, values and religiosity, if you talk about values, I'm no longer a Christian, but I respect Christian values. It's a very reductionist term, values. So I was afraid when hearing values that it would be very reductionist towards chaplaincy. So I had to separate myself from my own context and the value that I attribute to values, to open myself to your concept. And so in that regard, if we take into account all the cultural differences, of course we have a common ground, a certain common ground. I'm not discussing that. But the presuppositions that we have, if we don't question them and if we don't talk about them, then what do we do with an intercultural perspective? And intercultural perspective and values is something that I wonder how you think about. Because this isn't, part of your presentation. I'm sure it's part of your larger doctoral research, but not part of your presentation today. You can react, Niels, if you want to.
Yeah, thank you.
Yes,
Thank you.
let me just say, as you're thinking about that, maybe you can turn the slides off and we can just have a conversation. Yeah.
So, must be gone right now. Yeah, thank you, Anna. Thank you for your congratulations, but also for your question. I think that's a very important remark on the cultural rootedness and also spiritual rootedness of the profession. It's also something about when writing my dissertation, was also about who is my audience and my public, and how can I say something which might be useful for several contexts. I think on the micro level, only the Netherlands, it's also the question: does this model of professionalism, how do you prevent it from being kind of dominant over minority and other views on chaplaincy as a profession? So I think that's on the micro level, but it's even more the case on the international level. I think the rather simple model of values and expertise and positioning, which is still a bit functionalist, is not really a filled form of professionalism, so it needs to be filled, and I proposed a way of filling it. Is a way to talk with each other about what is then important in the profession. So when I propose that we should talk about the values in the profession, I think it also includes these issues. It also includes how are you rooted in your own spirituality, and how does it affect the way you look at chaplaincy. But I think the discussion has to be started, because if you only presume that we have the same concept of chaplaincy and we start sharing our research, but the presumptions are really different, it can be hard to sometimes cooperation or the use of, for example, research from Europe or from the United States might not fit to the cultural context. So I think discussing these issues with each other is not necessarily aimed at defining in a very strict way, this is what we are, and now we have defined what chaplaincy is about, but it's discussing the ultimate values of chaplaincy and how this affects also the way you're doing your research on chaplaincy. So I think I underline what you say, and yet you also said that only the notion of values already reminded you of your own, the way values are used in the Belgian context. So, well, I have to think more about that, how the model itself already has a kind of bias. But I try to have a kind of open model, heuristic model, that helps us to see, for example, that in the Netherlands, it's much about the purposes and goals of chaplaincy, while, for example, in the United States, it's much more about the interventions. So it helps also to see different emphasis in different contexts. And I think as such, this can help us to see the differences also between the countries and the contexts. I hope this is kind of answer to your question.
Could I come in here for a minute? If I understood Anne correctly, that part of Anne, what you're pointing to actually is in the Dutch context is quite secular. That's not as true in other national contexts and cultural contexts. And what does that mean for the values and for the professional identity of the chaplain? And if I understand Niels's work correctly, that's actually going to be an important focus of the webinar that we do in July. So that we'll come back to it again in terms of some of Niels' recommendations about how chaplains engage their own, we would say religious spiritual identity. The Dutch focuses on worldview perspectives. And I think Niels has some important recommendations about that we will come back to in July as well. But I think it's a great question, Anne. Go ahead.
Okay, I'll go to my next remark then. I was thinking about research because I recognized myself very much in the research-informed profession paradigm that you described, and I don't think there are only tensions between the three paradigms that you describe, presence being the second, the paradigm of presence to determine or to inspire professionalism. I think within the paradigm, there are already tensions, but that's maybe a technical discussion. I just want to think more about the research that we do. Does it really only cope or handle or starts with implied values? Because I can think of researchers, and I think it would be ideal if every research is like that or would take it into account, where you have the value and instrumental rationality together, where you ask for, why do you do this? And the motivational answers, they point towards purpose, they point towards goals, they point towards values. And on the other hand, you ask about interventions, and you ask about what do you do with that. And would you say that the case studies that you've participated in do both? Are they both value and instrumental based, and how are they? How is the balance between those two?
Yes, well, both perspectives were there present in the case studies project. Like the participants were asked to describe the practices, not so much starting from their goals, but first from what they did. And then they asked, why did you do it? And what did you intend with your intervention? So I think that's an interesting starting point. So not to start with the more ideological view on what you do as a chaplain, but to start with the practice itself and then reflect on it.
Do you advocate then for internal value criteria rather than for external value criteria? And that's my question, because you were talking about we should discuss what are the values of chaplaincy, and then we apply it to research and for a research agenda. While I think that there is a difference between internal and external value criteria.
Well, I would say we are only at the start of this process. So I think for now it's good to stimulate the discussion on the values we have by looking at the values we actually live by in our work. So the values that are actually active in our interventions and implied. So I think that's a good starting point to kind of describe and see not only what chaplains think, but also what they actually do. And it would be a good starting point for a discussion on the values. But I think once we have done that, it will be good that the values will also be kind of guidance for future research. But indeed, I do not think that we should now, just apart from our practices, sit together and talk about, well, these are my values. I think that's too much an ideological discussion then, which has also caused many polarization in the Netherlands, for example. I think that's not the way out. So the way of looking at each other's practices and then questioning, why do you do this and not something else? And why is this important to you? Brings us closer to the actual values. And once we've done that, I think those values can guide us as kind of external values, but coming from the internal values for future research. So that's how I think about it.
Yeah, well, if you look at other professions, for example, physicians, you could say that their purpose or their goal is do not harm, right? But do not harm as a value or a purpose doesn't mean the same thing to everyone. As you said,
Yeah,
values don't mean the same thing to chaplains too. And the question is, do you get out of discussions like that, whether or not you link it to the praxis and to expertise?
well, partly it will, I think, because what I saw in the case studies project is that some chaplains will say, well, I do not have any goal, and then they started. So it was kind of principle, and then when they started to describe the practices, there were in fact many goals present in their practices. So I think partly it helps to deconstruct also the ideologies. It has to be very precise to see how those values are strived for. So, which is like you say, do not harm can mean many things. So, but I think a case study, as an example, can also be other forms of research, but helps to, in a very rich way, describe how that do not harm, how it did look like, and where the choices were made to do this and not that. And I think it helps to make the values more concrete. Yeah.
Okay, George, can I ask one last question? Because I'm very interested, of course, as we all are, in what direction chaplaincy will evolve in the different parts in the world. And traditionally, in the recent history, we come from a charismatic model of chaplaincy to a therapeutical model of chaplaincy to a hermeneutical model of chaplaincy. Is the next step a heuristic model of chaplaincy according to your findings with your labyrinth purposeness?
Yeah, I think heuristic is actually a form of hermeneutic, only not necessarily based on narratives. So
it
I
would
think
fit your image of the labyrinth, I think.
Yeah, heuristic is indeed like the labyrinth. It's also, but it's a kind of flexible image. Like you have a kind of repertoire of perhaps therapeutic interventions and hermeneutic, and you use what you need to take the shape and to follow the course of the labyrinth. And it's not kind of you're from one school and this is what we do. It's the assessing. Perhaps it's in a heuristic part is perhaps the most important. But then you have a whole repertoire you can use as a chaplain. So I think it's interesting typification to say it's now the heuristic model of chaplaincy. Yeah.
All right, thank you so much. It's maybe a little bit of a too academic discussion, but it influences chaplaincy to its core, I think, from which paradigm you start or which paradigm is kind of influencing the day-to-day practice.
Yeah, it's very much connected.
Yeah, thanks. Sorry, Niels. Yeah. Thanks so much, Anne and Niels, for starting this conversation for us. Anne, as you just said, it's a little bit abstract. Chaplains are, in some sense, in their education and conversations, often more used to being more focused on the practical. But there are important changes, actually, that are taking place and tensions that we have experienced between being kind of focused on presence and focused on evidence-based practice, and how do we think about them as actually partners that are working together? As you said earlier, Anne, is that a rich part of what Niels has done is to suggest that these are not tensions that are kind of irreconcilable, but there's actually important ways in which they work together, and we had a great introduction to that today. Niels, with your conversation about chaplains may not always be seeking solutions, but they are purposive. And sometimes that purposiveness actually has a circular, labyrinthic quality. And so I think we're indebted to you for your helping us think about these things in some creative and fruitful ways. A reminder to everybody, we're going to come back again in July 12th, and continue the conversation with Niels around two other parts of his research, both the work he's done to think about expertise and frame that in terms of wisdom, and then think about our positioning ourselves and what it means to think about our worldview identities in a post-secular context. It's really rich material, and I'm looking forward to that conversation. Joining us in July will be our colleague from here in Los Angeles, Dagmar Griffa. Dr. Griffa is the manager for spiritual care at Children's Hospital of Los Angeles and a CP educator. And we're looking forward to a conversation with Niels and Dagmar in July. Thank you, Anne, for joining us today for the conversation. And friends, we look forward to being with you all, having you back again in July. Until then, be well and take care. Bye-bye.
Thanks, everybody.
Bye-bye.
Bye.